These are medications you need to stop before having surgery. Every hospital has slightly different policies, but these are ours. And the medication categories you have to stop before surgery essentially fall into two different categories, one being blood thinners and two being certain diabetes medications. It may be sort of obvious, but the reason why we stop certain blood thinners before surgery is to decrease the chance of you bleeding during surgery and after surgery. And so the most common one people are on are aspirin, either an 81 milligram or a 325 milligram aspirin. You do not need to stop these before having surgery with me. It's a blood thinner that isn't strong enough to stop, and we continue it throughout the perioperative time period. Coumadin or warfarin, we stop for 5 days before surgery, and it's up to the surgeon and what your reason for being on the blood thinner is. Sometimes we need to do what's called bridging, is when we give you Lovenox after we stop your Coumadin to make sure you don't get your blood thinning capacity diminished too much before and after surgery, but most of the time, just stop 5 days before. Plavix is another blood thinning medication you need to stop 5 days before surgery. The blood thinner medications to stop is the 10A inhibitors, and the most common ones are Eliquis and Xarelto, and those we stop 2 days before surgery. And those are the main blood thinning medications we need to stop before surgery, and the decision of when to restart them after surgery is sort of up to the scale of surgery that you had, meaning a bigger surgery, you wait a little bit longer. Smaller surgeries, you can usually start the blood thinner in the next 2 days. But I'll tell you that after your surgery, when to restart these blood thinners. The next class of medications that need to be stopped before surgery are the diabetes medicines. The most common one is metformin, and that has to be stopped within 24 hours of surgery. And the reason for this is it has a hypothetical metabolic acidosis it can give. I've never actually seen it in my practice. Would love to know if somebody has, but that's the theoretical reason why we stop that a day before surgery. The next diabetes or weight loss category is the GLP-1 medication, so the Ozempics and the other similar analogs. We have to stop that 7 days before elective surgery at my hospital. The literature is evolving a little bit about whether or not that's actually necessary, but as of now, 2025, that's our policy at our hospital. And the reason for that is basically why that medication works is it decreases your ability for your stomach to empty things, right? And so it makes you feel full and you eat less. One of the ways it works for weight loss. But for anesthesia, if you still have a stomach full of food because your stomach isn't squeezing well because of the Ozempic, then when you get the breathing tube put in for surgery, it increases the risk of you aspirating or throwing up, and it goes into your lungs. And so Ozempic and other similar medications are 7 days before surgery, you have to stop. Those diabetes medicines that we stop before surgery, you can essentially restart them the next day after surgery. And there are a few other random medications you have to stop before surgery, but in general, that's 95% of the medications we talk to patients about stopping. And in clinic before